I spoke just a few minutes ago with Linda Douglas from the White House staff. And we're joined now by Linda Douglas of President Obama's staff. She's the one in the White House that sort of keeps an eye on what's happening on health care. And when people make mistakes in reporting the story, she's quick to help them make corrections, at least from the White House point of view. Linda, thank you for joining us. So I guess this is kind of like in the spin room after debates during a campaign. You're on the Obama team. How do you think the president and all this is going so far?
Well, I think that anybody watching would see that this was an open, very frank exchange of what turned out to be a lot of common thoughts, a lot of common ideas. There was a lot of agreement on ways to approach the issue of how to make sure that costs are lower in health care and how to make sure that Americans have a little bit more power over insurance companies. You know, you heard them talking about how there have to be pools for small businesses to band together to buy coverage, which lowers costs. You heard how they agree, the Republicans and the Democrats, that there's got to be a crackdown on waste, fraud, and abuse in public health care spending. You heard them talk about how they agree that there's got to be emphasis on prevention and wellness inside of our health care system, another way to lower costs. They talked about selling insurance across state lines. There was agreement there, so there was a lot of agreement. One area, Bob, where there was not agreement, it seems, to me, listening to the president, maybe a philosophical disagreement, is that, the president believes that there should be a minimum level of benefits that consumers can count on when they buy health insurance, so that they know they're actually covered, so that you know that when you go to the hospital, if a woman has a C-section, the insurance company doesn't decide how long you stay. The woman and her doctor decide. There seems to be a disagreement. Our view is that there should be a minimum level of coverage that every American can count on, common sense minimum. But our colleagues there at the table didn't necessarily agree on that. But again, a lot of common ground.
Well, we'll get the Republican view of this a little later in the broadcast. But Linda, let's get away from the process. We're asking people, as we said before, to send in questions on Twitter or Facebook. Katie Hartung is watching the emails as they come in. Any questions for Linda here?
We do have one for Linda from Neil in New York. He asks, is this healthcare summit a display of real reform or just politics as usual? Can we expect results or the Obama keyword change out of this?
So what about that, Linda?
Well, I think that's a very good question, and there is no question that the president is aiming for results. Health insurance premiums have doubled in the last 10 years, 3 times faster than wages. Out-of-pocket expenses have gone up another third. A business group, the Business Roundtable, concluded that if we do nothing in the next 10 years, we're going to be spending nearly $29,000 per employee on health care. It's crushing our government. We need to try to reduce the deficit with health insurance reform. So the president is very focused on results. And what you've heard this morning is a real discussion of where the areas of agreement are, where we could find, some way to bring the Republicans into this effort to try to bring relief to the American people.
Linda, I think going into this morning, most people would say that right now there really aren't the votes in the House to pass the Senate bill, certainly, and maybe not to pass any health care right now. I'm not sure there are the votes in the Senate now to pass anything. Do you sense that anything happened today or has happened so far that might change that?
Well, Bob, it's hard. I'm not a vote counter. I'm not a whip. You and I both covered the Congress back when I was a reporter. It's very hard to know, in the end, whether, where any kind of final effort is to resolve the very small number of remaining differences between the House and the Senate, because the important thing here is that the House and the Senate have both passed legislation that is built upon the president's principles of lowering costs, making sure that consumers have more power than insurance companies, making sure that we reduce the deficit, and making sure that everybody has access to stable insurance companies and they can't deny you coverage because you've got a pre-existing condition anymore. That is in both bills. There are a few remaining differences. The president has made a proposal to bridge those remaining differences, making it more affordable, for example. There are conversations going on, but right now we're in a process where we're talking to the Democrats and the Republicans to resolve these differences, find common ground, and bring this relief to the country.
All right, let's, Kaylee, any other questions there?
We've got another question from Diana in Redmond, Washington, and she asks, Is there a good health steward discount on the table similar to a good driver discount? Seems there are a lot of preventable things we as individuals can do that would decrease health costs, but we're not incentivized to do that.
Well, that's a very interesting question as well, and it turns out that the answer is yes. In this legislation, there are programs that employers can use to create incentives for healthy behaviors, such as going to the gym, or taking other steps that might be able to make you a healthier person. Certainly, smoking cessation incentives and so forth. So there are incentives in the prevention and wellness programs that really would create incentives for people to pursue a healthier behavior. And that is one of the things that the Democrats and Republicans believed was very important to do in this legislation.
All right, Linda Douglas with the White House side of things and a little review from the White House perspective. Linda, thank you so much for being with us. Great to see you again.
Thanks for having me, Bob.